Hi everyone, welcome to the YouTube channel with Dr. Man. This video is going to all about the plastic surgery. In the previous video, we have finished the urology. Let's start with the plastic surgery. This is not the very big chapter; it's a very small chapter, but very high. Every time you may expect, I think, maximum 2 or 3 courses from this chapter. Okay, so when we start to read the plastic surgery, first we need to know about the skin. Okay, skin. All the layers of skin, and you must able to differentiate on the I mean the given diagram that this is the Blasco's line and this is the Langer's line. So you know how does it look like, the Langer's line and the Blasco's line. After reading the about the little bit anatomy of the skin, you have to go to the proper plastic surgery topic, in which you have to remember first about the scars. Okay, read about the keloids and hypertrophic scar. Even they will give you the image based question, and on the image you have to identify that okay, this is the keloids or this is the scar. And read about the treatment of both of these condition, because they ask so many times. And then when you finish reading the the scars, you have to know about the graft versus the flap. You must know what is the difference between graft and flap. What is the definition of graft and what is the definition of flap? And you have to, in the graft, you have to remember about the split thickness skin graft and the full thickness skin graft. Okay, their others name as well. They will use sometime. So know the others name as well. Read in the details about these two grafts. They will give you the image based question as well. So from the plastic surgery, they give you the image based question very frequently. So watch every they look at the all the images whatever is given in your notes from the plastic surgery topic. Okay, so as you finish the graft and flaps, read all the flaps. Okay, like we have the the transverse rectus abdominis flap. We have the tram flap. We have the DIEP flap. Deep inferior epigastric perforator flap. And then we have the VY plasty. We have the jet plasty. We have the forearm flap. We have the commando procedure. So read all the flaps. Okay, and each and every flap has their own blood supply. So read about the blood supply as well. Okay, try to remember the name of that blood. The blood supply or the artery of that the flap. Then as you finish the flap and graft, move to the topic that is bed sores. Bed sores is one of the highly ill topic. The subtopic. So must remember the grades of bed sores and their treatment. In treatment, they will ask you mostly the vacuum assisted closure. Though they ask you the even the image based question of the VAC, the vacuum assisted closure, and they will ask you the what is the pressure we use while giving the vacuum assisted closure. So in the bed source, we have to remember about the all the the grading of bed source, their image based, okay, and their treatment about the VAC, vacuum assisted closure. And after finishing the bed source, you have to move to the one very important topic, not proper in the plastic surgery, but this is combination of the plastic surgery and the pediatric surgery both. That is cleft lip and cleft palate. Their surgery is very important. You have to remember, like they will give you the age, they will give you the scenario like only cleft palate baby have, or the baby have both cleft lip and cleft palate. So you have to they will ask you the treatment of that baby. So you have to remember on which age, if it is only cleft palate or if it is cleft palate with cleft lip, what will be the surgery and at which age we will do the surgery. So we have to remember about that, the cleft lip and cleft palate. Then one last topic which is left is it is the combo of both surgery and the pathology. That is the stage of wound healing. They so many time ask the stages of wound healing. We have 3 or 4 stages of, like we have the hemostasis, we have the inflammation. So there are 3, 4 or 5 stages of wound healing. You have to remember each and every step of wound healing, and they will ask you the days, on which days which stage of wound healing will be seen. So you have to remember about that as well. Okay, and one more thing I have left, that is about the flap. Okay, in flap also there is the process of the survival of flap. Okay, there are 3 or 4 process um, which is the process of survival of lab. So you have to remember about that process and say the days, on which days which things takes place. Like they will ask you about the imbibition. Okay, so you have to know that on which days imbibition takes place. So you have to know like that, on which days which process takes place for the graft survivals. Okay, so this was all about the plastic surgery. It is very small topic, not very large topic. There is very limited subtopic in this. There are only 4 or 5 subtopics. Go through once and look at the all the images given in your notebook, because image based question is very important from the plastic surgery. So many times they will give you the only image, and just you have to identify what kind of lab we have used, what kind of scar is this. Okay, so this was all about the plastic surgery. In the same way, read about all the topic and do your PYQ, and I think this is enough for this plastic surgery chapter per se. Thank you guys, see you in the next video.